narito po tayo ngayon sa Bagbag upang magpahayag ng isang istorya magbibigay inspirasyon sa ating lahat. Tunghayan po natin kung paano pinaglalabanan ng mga special ed ang kanilang mga kondisyon.
Ito na, okay na.
Head rotation. 1, 2, 3, 4, 5, 6, 7, 8. 8, 7, 6, 4, 3, 2, and 1. O, shoulders. 1, 2, 3, 4, 7, 8. Balik. 8, 7, 6, 5, 4, 3, 2, and 1. Next. Ano naman? Ganun, di ba? 1, 2, 3, 4, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, and 1. O, just keep playing. Ready? Go! 1, 2, 3, 4, 7, 8, 8, 7, 6, 5, 4, 3, 4, 5, 6, 7, 8. 8, 7, 6, go! Patrick, o si Patrick, Elaine, at saka si Reynaldo. O, yung tatlong senior natin. Ready? Ready? 1, 2, 3, go! Yun, si Patrick. Si Patrick yun, si Reynaldo. Si Reynaldo. Very good, si Reynaldo. Hawak-hawak ulit. Hawak-hawak. Mayroon dito kanina.
Autism is a disorder in the brain's data processing. Information entering through the senses is processed differently. Autistic persons have trouble turning details into a coherent whole. This takes more time and a lot of effort. So many are overly sensitive or not sensitive enough to certain stimuli,
Hi, hello, how are you?
such as sound or physical contact. They may react in a way that is incomprehensible to outsiders. There are several forms of autism. The most common are classic autism, Asperger's syndrome, and PDD-NOS. Because they process information differently, communication, social interaction, and imaginative powers are difficult for them. What is the result? Autistic persons often take information literally and have problems with indirect non-verbal communication, such as proverbs, gestures, or facial expressions. This may cause confusion and miscommunication. Contact with other people is difficult for them because it's hard to understand the other's thoughts and intentions. There's a lack of reciprocity, and making contact can be tough.
Police, stop.
The imaginative powers aren't well developed. So it's hard to form a realistic picture of things not present in the here and now. It's difficult to assess cause and effect. Moreover, planning and organizing is often a problem. This may cause rigid behavior, clinging to acquired and familiar rules. It provides a feeling of structure, security, and reliability. With some people, breaking a routine or unexpected situations may lead to panic. Autistic people often focus on one detail,
A football.
Their repertoire of interests and activities is remarkably limited. Do you suspect autism? Always ask for the AutiPass. It describes how to recognize autism, and it contains tips and advice about how to talk to autistic persons.
How to recognize the early signs of autism. Early intervention is important for children with autism, a developmental disorder that inhibits socialization, so be on the lookout for warning signs. You will need knowledge of developmental milestones and careful attention to your baby's behavior. Optional, a hearing test for your child. Do not assume that if your baby exhibits behaviors associated with autism, they necessarily have the disorder. Observe them carefully and bring any concerns to a doctor. Step 1. Pay attention to when your baby begins to babble. They should start at around 5 months old. Step 2. Begin monitoring eye contact at around 6 to 9 months, when infants generally start smiling in response to their parents' grins. Babies with autism tend to avoid looking at their parents. Step 3. If your baby makes a sound, make one back and see if they reciprocate. Babies with autism usually do not take part in this verbal turn-taking, nor do they participate in peekaboo. Step 4. Note whether your baby responds to their name. They should begin to do so starting around 10 months. Babies with autism often ignore people trying to get their attention and don't solicit anyone else's attention. If your baby ignores you when you call their name, get their ears checked. They might have a hearing impairment. Step 5. Note their behavior around 12 months. By this point, most babies are pointing, waving, grasping objects, and attempting to speak. Step 6. Gauge your baby's sensitivity to sound and touch. Many children with autism are unusually sensitive to loud noises and hate being cuddled or touched, yet they sometimes underreact to pain. Step 7. Note their focus. Do they tend to fixate on a favorite object or part of an object to the exclusion of other people, including other toddlers? Step 8. Look for repetitive movements associated with autism, such as rocking back and forth, hand flapping, and twirling. Step 9. See how set in their ways they are. Children with autism often exhibit strong resistance to changes in their routine. Step 10. Keep track of their vocabulary. At 18 months, most babies can say about a dozen words, and by the 2-year mark, they're usually initiating 2-word phrases. Step 11. Some children with autism seem to develop normally until 18 to 24 months, then stop or regress in speech and other growth. Consult your pediatrician if your child regresses or if they exhibit any of the behaviors previously discussed. Did you know? Canadian researchers have found that the intelligence level of people with autism spectrum disorders has been underestimated, and that many of them could excel at highly structured jobs in math, science, and law.
How to help a child with autism. Early intervention is the key to improving the outlook for a child with autism, a neurological disorder that impairs communication and social skills. Here are several strategies you may want to consider. You will need a medical workup, a gluten-free, casein-free diet, speech, occupational, and alternative therapies, and school enrollment. Optional, a nutritionist or dietitian. Step 1. Take your child for a complete medical exam. Some behavioral problems associated with autism, like temper tantrums, can sometimes be reduced if physical problems common in children with autism, such as gastrointestinal issues and allergies, are alleviated. Step 2. Put your child on a gluten-free, casein-free diet, which means no barley, rye, oats, wheat, or dairy. Many families of children with autism have had good results, but only if the diet is followed to the letter, no exceptions. To make sure your child is getting the proper nutrients despite these restrictions, consult a nutritionist or dietitian. Step 3. Get your child started on speech therapy as soon as possible. If your child is nonverbal, try PECS, which stands for Picture Exchange Communication System. This technique, which uses picture cards, may encourage them to speak. Step 4. Get your child sensory integration therapy, which has been proven effective in helping children with autism become less sensitive to light, sound, and touch. Step 5. Hire an occupational therapist to help them with skills they'll need for an independent life. Depending on the child, this can be anything from physical coordination to anger management. Step 6. Use Applied Behavioral Analysis, or ABA, the only intervention approved by the Surgeon General's office. ABA is a one-on-one approach to teaching children how to react appropriately to everyday social situations with the help of rewards. Parents can either hire an ABA-trained therapist or learn the technique themselves. Step 7. Try other therapies. Most children with autism benefit from a combination of treatments. A popular exercise is floor time, in which the parent or other caregivers get on the floor with the child and mimic how they play to encourage them to let others join in the fun. Step 8. Consider verbal behavior intervention, which is designed to develop language skills through motivation and reinforcement. Step 9. Test the teach approach, which customizes an education program to the child's strengths and weaknesses. Because children with autism tend to be visual learners, the program is structured around visual clues. Some autism experts think the teach system tries to incorporate too many interventions and winds up diluting them. Step 10. Consider becoming trained in Relationship Development Intervention, or RDI, which suggests everyday things parents can do at home to help their child adapt to changes and be more open to interacting with others. Step 11. Enroll your child in school when they turn 3. The Individuals with Disabilities Education Act requires that states provide special education services to children with disabilities beginning at this age. Step 12. Stay up to date on autism research. New therapies are being tested and developed all the time.